All right, we are going live. We can get started. All right, Brandy, it's on you.
Hello, everybody. My name is Brandy Gowder. I am a member of the National Black Doula Association. And welcome to the National Black Doula Association Masterclass with the Irth App. Today, we are doing a masterclass on culturally competent care, and our guest speaker is Tabia B. Tabia B is a community organizer, maternal health advocate, and holistic healer, deeply rooted in the belief that true change begins with listening to and empowering families. She channels her personal journey through motherhood and healing into her relentless work for equity, and systemic change within organizations such as the Earth App and coalitions like COCNJ. Professionally, Tabia's foundation is built upon degrees held in psychology and hands on experience as a social service caseworker, where she witnessed firsthand the systemic barriers facing vulnerable families. This inspired her to become a licensed massage therapist, specializing in prenatal care and pain management to provide tangible, trauma informed support to expectant mothers. Tabia is ultimately driven by a single goal to be a dedicated voice for her community and for future generations, working to overcome historical barriers and create equitable outcomes for all. And now I'm introducing our guest speaker, Tabia B.
Thank you, Brandy, for that wonderful introduction. As Brandy mentioned, my name is Tabia, and I am here to speak with you all about culturally competent care and how it relates to us as birth workers. So, we are in the midst of a Black birthing crisis, not because of our bodies or because of the bias embedded in the systems that are meant to care for us. So, our role as doulas is not just to support our birthing families, but it's strategic intervention. So, for the next 20 minutes or so, I would like for us to move from not only understanding what bias is, but to building a practical toolkit for interrupting that bias, and then how we can um, take that into practice when we are supporting our clients. Next slide, please. So we'll be discussing the reality, the statistics, interrupting bias, and then how we can continue to work together. So next slide, please. This is the alarming statistic that we all hear about um, when we're on our webinars, when a mother or a family comes to us and hires us to support their birth because of this grim statistic here. And it is these numbers that make it critical for women of color birthing in this country to need support. And that's what we give them. Because of this number, 243% more likely to die from pregnancy and childbirth related causes, 80% of those maternal deaths being preventable. We know that the bias is well documented. But we have to think of bias as a loud, single act of prejudice. It's often silent and systemic protocol that leads to this, though. And it's this assumption that dictates whose pain is believed, whose questions are honored, and whose autonomy is respected. And our first job is to recognize the patterns and not just the incidents. So that's some of what we are trained to do at the Earth App. And that's some of what I would like to go deeper into detail to discuss with you all today. This could look like consistent undertreatment of pain. Perhaps you're supporting a client and she is letting the hospital staff know that the epidural is not strong enough. She can still feel her symptoms and it being ignored. Or perhaps she's being labeled as non-compliant versus being seen as someone to collaborate with. There is a deficit-based framing for our Black families, and you, birth workers, are the trained eyes and ears and the first tools of interruption. So I would like for everyone to leave this class empowered in that way. Next slide, please. So some things we can take away or take with us in our pockets as we go out into this work is these 3 tools. We witness, name, and challenge bias in care spaces. We must center our clients' voices, their autonomy, and their dignity, and we must work collectively to shift systems, not just outcomes. So before you speak, you must notice what just happened. Say you notice that a doctor or a nurse casually says, "Oh, you people have a high pain tolerance." That is something that sticks out to you. That's something that activates that red flag of advocacy in you. And you need phrases that are respectful yet unyielding. So your response back could be, let's make sure we're centering, and you use your client's name. Let's make sure we're centering my client's priorities here. Or can you help me to understand the medical necessity behind that recommendation? That way, you're being seen more as a collaborator. You're still a disruptor, but you're not confrontational. And you're bringing the focus back to evidence and autonomy. And this often level sets the room at any given moment. You, as the birth worker, are the energy worker in the space. And what you are aware of and how you wield your power determines the outcome, can determine the outcome for yourself and your client. Lastly, reinstating that the client has the authority. Your ultimate goal is to transfer this skill to your client. You want to prep your client ahead of time with questions like, what is the alternative? So that they know how to advocate this for themselves should you need to step away for any reason. Also, you want them to know how to advocate for themselves on paper by saying things like, can you note the refusal in my chart? So that there is a paper trail of evidence that shows this is the outcome we are working towards. And you want to remind them that you're a team, and also reinstate in your client that they are the consent givers, not just consent receivers. Next slide, please. So this is more on the practical strategies that we were just discussing. Again, witness naming, noticing plus respectability, and client empowerment. These 3 buckets are always going to recalibrate you back to a place of groundedness as a birth worker in these spaces. And it will help you to bring awareness to harmful language or behavior. It will help you to make visible when you're being made to be invisible or your client is being made to be invisible. And it will help you to advocate for care regardless of tone or expression, because you're going back to a place of respect. And therefore, what you give, you should receive back. And lastly, you want to model advocacy language so that your clients can use that themselves. Next slide, please. I'd like to give a scenario, something I've seen in rooms myself. Your client, she is uncomfortable and nothing is working. The switching positions is not working. Resting is not helping. She's genuinely uncomfortable. And the nurse says to your client, you people have a high tolerance, kind of diminishing your client's experience. I'd like for you to ask yourself, what bias is present? What do you see here? And what could your role as the doula or birth worker, what could your response be? And then you want the goal of your response to interrupt the harmful language and recenter the client's lived experience so that you can advocate for appropriate pain assessment. So let's do this together. You notice the racial stereotype, you notice the dehumanization, you notice the assumption, you notice the assumption that Black people experience pain and tolerate it differently. And that's a red flag for you. So, what you can do is pause and clarify that pain is subjective and your client is expressing that they are in pain and need support right now so that you can interrupt that harmful language. Often, implicit bias is rooted in medical racism that minimizes pain reports. So, what you can respond to that and say is, my client is requesting pain management. And what are the options? Can you please explain what's available at this point? So you bring the nursing staff, the doctor, everyone in that room back to the present moment. Sometimes people don't even realize how much their biases are shaping and framing how they deal with people in the day to day. And when you do that, you shift the focus from stereotype to clinical care and you ensure access to options. Then you're also noticing the power imbalances that silence and diminish the client. It dismisses their presenting problem. It can often make a client feel unseen. So you turn to your client as a doula and you say, you deserve to be taken seriously, or I heard you, or let's make sure that the nurse staff, the doctor hears you as well. What would you like me to do? How would you like me to advocate for your next steps? You include them. You're a collaborator. That is why you're there with them in the first place. And then this restores your client's agency, affirms their dignity, and supports informed consent. Next slide, please. So this is just a little bit about how you can take a moment to show up as the advocate that you are. Doulas are often the silent force in a room, making sure that eyes are and ears are in all the spaces and places from the moment you walk through those hospital doors, from the moment you greet security. You are part of this this birthing person's experience, and it is heavy at times to feel like you have all of these odds stacked against your client, let alone you, and remembering how to maintain your composure at all times. So I would like to reaffirm you all that this work is sacred and you are needed, and to deepen your practice, implore you to deepen your practice so that you may amplify your impact. This is a wonderful association that equips you with knowledge on a monthly basis. At Irth App, we have a wonderful ambassador program as well, where we collect reviews from Black and Brown birthing families. And, you know, if you have the opportunity to join community, it adds longevity to your practice as a birth worker. Next slide, please. So this is my contact information where I can be reached for any New York City-based inquiries. I am happy to continue to be a resource. It's not easy work, and the reason we've made so many strides is because birth workers across the world are being vocal, are standing up, are empowering their clients, and it's no longer a luxury to have support in the birth room. And our tone conveys the urgency and conviction through our voices. So we must continue to be empowered in our work. We must continue to take care of ourselves as we're taking care of our clients. And we must remember these key facts that make us be able to deliver culturally competent care. So I will pause for now and happy to take any questions.
So I do have a couple of questions from the audience. The first question is, what does birth story data mean in practical terms, and why does it matter for Black maternal health outcomes?
What does birth story data mean in practical terms? So, similarly to the examples I was sharing about pain levels often being dismissed, that is one of the key complaints that we find in the surveys that we give to our families, along with uh, lack of eye contact. Um, there are so many ways to dehumanize a person, who is coming into an institution to give birth. So if you can just take yourself through all of the checkpoints and all of the ways that a person can make you feel less than, those translate to data in real time as well. And what was the second part of that question?
It was, and why does it matter for Black maternal health outcomes?
Well, what it does is it disrupts the medical racism that is built into the system. And if we are able to interrupt the bias as it's happening and possibly bring to attention, when it's happening, we can stop an unnecessary death.
Thank you. And then we have another question that says, how can doulas collect meaningful information without turning support into paperwork pressure?
Say that again.
How can doulas collect meaningful information without turning support into paperwork pressure?
You can utilize your notes. You can use your voice memo to kind of talk yourself through key instances that stand out to you. Um, you can take notes of the staff that's present throughout the different shifts. Um, I do understand the burden of paperwork pressure. So it's kind of just getting creative with the tools that are available to us at any given stage. I'm a paper to pen person. So
Yeah.
I really enjoy, I keep like a notebook on me. But if you are somebody who needs to be on the go or you're always on the go, send a voice note to your accountability person or your birth worker buddy, and just make sure that you're going into detail and rehashing what you remember, and make a note to yourself like, let's revisit this later. Additionally, if you want to put the pressure into a more streamlined space, shameless plug, the Irth App is a great space to do that, because what we do is take your stories and then turn that into, actionable steps. So,
Okay. And then how do you protect client privacy while still documenting patterns that show systemic issues?
so my role here at the Irth App is to collect those stories. Everything is anonymized in our app. But I would say something I practice is I speak for myself and I speak from experience. And that simple grounding technique kind of takes you out of telling someone else's business and telling your own perspective. So instead of, and then he shoved his hand inside, like, I witnessed the doctor not, proceed with consent. You see how that's different than telling, the client's personal experience. You're shaping it from your lens.
Yeah, that makes sense.
Hmm.
And then they also have how can doulas document cultural and emotional safety, not just clinical events?
Um, Ahead of time is always ideal. Um, Getting to find out who is going to be on shift around the time that you're expecting to go into the institution with the person you're supporting. Um, Making sure that the family of the birthing person also has the same notes so that they could reiterate in case there is a gap, or maybe somebody is covering a shift, maybe there was an unexpected person. Just more hands make light work. So if we're all on the same page in supporting this client and making sure that it's documented in their file, this is what we do here. Maybe we like our rice and peas, a celebratory dinner as soon as, baby is born. That's important to us. What are the policies around that? It's just really asking clarifying questions, not being afraid to ask those questions either, and making sure that you as birth worker are making sure it's documented somewhere, written on the chart, written on the door, whatever is needed.
Yes. And then we have a comment from Instagram. It says, "How do you recommend doulas introduce documentation to clients in a consent-based way?"
How do you recommend doulas introduce documentation to clients in a consent-based way? You
Yes.
just ask them, do I have your consent to take notes? Do I have your consent to record this? It goes back to the empowering your client and recentering your client.
And what is one documentation habit every doula can start this month that will make the biggest difference?
Download the Earth app.
Yes.
And it we encourage you all to, like, while it's fresh in your mind, utilize that review feature, because you'll remember more details that way. And the story is really important because that's how the patterns are uncovered. If you're a week out and you're like, what was that nurse's name again? What was that doctor's name? Not that it doesn't matter, but it kind of changes the story. So
Yeah.
just, I would implore any birth worker, as soon as you know the high is over and you have a moment where you're kind of breathing and debriefing with yourself, jot down 5 things that stood out and the names of the supporting people in the room, because it's going to help you to look back and retell yourself the story. Well, why did I write down this person? And what was it that they, oh, yes, that was the nurse that rolled her eyes when she was, you know what I mean? So it's
Yeah.
just a way that you keep it alive.
Definitely. And I do that as a doula, especially after every birth. It's always good to release that and then definitely get it on paper because I know I'm very like, let me go through every little detail so that I can know what I can do better. So having all of that on hand like a little notebook help you to remember those things that you might have forgotten just so you can come back to it. So I think that's really good.
And if you don't
You
have a
get
notebook, talk to your phone, or call your
yes.
doula friend and say, like, can I talk this out with you? So that now
Yes.
you have somebody who's like, wait, did I hear that right? Did she really not put a glove on? Like, like somebody who is trained to also support you in this work, a safe space for
Yeah.
yourself.
Doulas need doulas for
Yes, they
sure.
do. Yes, they do.
Yes. And then you're getting a lot of love in the chat, and I just want to greet everybody who is coming in and getting all this good information. We're gonna take a couple of more questions, and then And then go ahead and close the masterclass out. So I do have, hold on for 1 second. Oh, we got New Mexico in the chat right now.
Hey, New Mexico.
Okay. What should doulas document when a client reports feeling dismissed, unheard, or unsafe?
The time that it happened so that you could pinpoint who was on shift. If you can get the name or the last name of the people working that shift, the presenting issue that was dismissed. So my client wanted to change positions. No, we don't need to do that right now because we do that every 7 hours. Okay, take a note. I
Right.
suggested this, it's just the 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 setup to bringing them back to the plan versus the deviation of the plan. So whenever there you sense like, hey, we're going off course a little bit, it's time to document.
Yes. And then we have one more question, which is what are practical examples of how documented stories have changed policies, practice, and accountability?
I mean, related, unrelated, the civil rights movement, all those pictures that we see, all those meetings that happened led to something huge and kind of changed the course of history for all of us. So it may seem like it's just small, like you're one person in like a big sea, but this is going somewhere, and just remain empowered that you are part of a movement and there's a bigger picture here. Those statistics that we hear, they're so alarming, and we are just so used to rattling them off at this point. So I would think the goal would be, how do we reverse those statistics? I would love to know that the numbers are getting smaller and shrinking and the instances are diminishing. But that can't happen if we don't realize our power, like each one person power.
Yes. And then the community needs the Earth app is helping people to know where we're being taken care of and the
Period.
spaces that we can go into. So
Yes.
I really appreciate you, Tabby B. Now we have Joy. Hey, Joy.
Thank you so much, Tabia. Thank you so much, Brandy, for helping us moderate. Just coming with some quick announcements just before we wrap things up this evening. If you guys are interested in joining another NBDA and Earth App event, we will be having a practice what you doula workshop on Ooh, February the 28th, guys. So please, 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 if you're interested in March the 28th, got my dates wrong. March the 28th, if you guys are interested in that workshop, please join. If you would like to see another Earth App and NBDA event to fruition. Other than that, we have our Journey to Doula World every month, which will be on February 11th, and then we'll have membership orientation on February 18th. So, if you guys are interested in signing up for any events that we have coming up, please go to our events page so you can sign up. Again, thank you so much, Miss Tabia, for this amazing masterclass. We're going to wrap. Thank
Thank
you all.
you so much. Thank you, NBDA.